time.
Mr. President, you said yesterday that it would be unprecedented for a Supreme Court to overturn laws passed by an elected Congress. And that is exactly what the court has done during its entire existence. If the court were to overturn individual mandate, what would you do or propose to do for the 30 million people who wouldn't have health care after that ruling?
Well, first of all, let me be very specific. We have not seen a court overturn a law that was passed by Congress on an economic issue like health care that I think most people would clearly consider commerce. A law like that has not been overturned at least since Lochner, right? So we're going back to the 30s, pre-New Deal. And the point I was making is that the Supreme Court is the final say on our Constitution and our laws, and all of us have to respect it. But it's precisely because of that extraordinary power that the court has traditionally exercised significant restraint and deference to our duly elected legislature, our Congress. And so the burden is on those who would overturn a law like this. Now, as I said, I expect the Supreme Court actually to recognize that and to abide by well-established precedents out there. I have enormous confidence that in looking at this law, not only is it constitutional, but that the court is going to exercise its jurisprudence carefully because of the profound power that our Supreme Court has. As a consequence, we're not spending a whole bunch of time planning for contingencies. What I did emphasize yesterday is there is a human element to this that everybody has to remember. This is not an abstract exercise. I get letters every day from people who are affected by the health care law right now, even though it's not fully implemented. Young people who are 24, 25 who say, you know what, I just got diagnosed with a tumor. First of all, I would have not gone to get a checkup if I hadn't had health insurance. Second of all, I wouldn't have been able to afford to get it treated had I not been on my parents' plan. Thank you, and thank Congress for getting this done. I get letters from folks who have just lost their job, their COBRA is running out, they're in the middle of treatment for colon cancer or breast cancer, and they're worried when their COBRA runs out, if they're still sick, what are they going to be able to do because they're not going to be able to get health insurance. And the point I think that was made very ably before the Supreme Court, but I think most healthcare economists who have looked at this have acknowledged, is there are basically two ways to cover people with pre-existing conditions or assure that people can always get coverage even when they have bad illnesses. One way is a single-payer plan. Everybody is under a single system, like Medicare. The other way is to set up a system in which you don't have people who are healthy but don't bother to get health insurance, and then we all have to pay for them in the emergency room. That doesn't work, and so as a consequence, we got to make sure that those folks are taking their responsibility seriously, which is what the individual mandate does. So I don't anticipate the court striking this down. I think they take their responsibilities very seriously. But I think what's more important is for all of us, Democrats and Republicans, to recognize that in a country like ours, the wealthiest, most powerful country on earth, we shouldn't have a system in which millions of people are at risk of bankruptcy because they get sick, or end up waiting until they do get sick and then go to the emergency room, which involves all of us paying for it.